okay? So what are our advantages? We want to know. We want to keep the area dry. We have a wet mouth, and we're constantly working in the wet mouth, and our materials are hydrophobic. They like dry things, so it doesn't match up so well. So when we isolate properly and prevent contamination, we're going to get better results when we put our liners in under our restorations or our bases. We'll learn about those, and insert our restorative materials, be it a preventative material like a sealant or a composite or amalgam restoration, okay? So this is a rubber dam. The bottom line is we want success, okay? Again, next week we'll talk about rubber dam. Rubber dam is considered ideal, but we probably are not going to do ideal here. We'll probably stick with cotton rolls. Okay, so what's required? Well, we want to isolate the clinical crown because that's what we're working on. Additionally, we want to retract the cheeks with those cotton rolls and the lips, okay, and the tongue, because all those things are wet, and if they get on our tooth, it can cause a problem. It'll cause contamination. So if we have something contaminated, it's wet and bubbly, we don't have good visibility. Now, this method, cotton roll, does not prevent aspiration. Rubber dam does. So you want to be careful because it does not prevent aspiration. Cotton roll methods do not. So with cotton rolls, there's different ways to put them in. When we're working on the maxillary, oftentimes we just need in the buccal vestibule. When we're working on the mandibular, we need one in the buccal vestibule and two, typically, depending on how deep the floor of the mouth is. Okay, now cotton's nice and soft, but if you're in there pushing it with your finger, they can hurt. So you want have you ever had your dental assistant that would put this little pillow in there and you didn't even know she was in there? Okay, that's what we're trying to achieve, as opposed to the one who's janking your lip around and shoving that thing in. That's not what we don't want. So cotton rolls are quick and easy. Why we do it. What we have here are these little plastic cotton roll holders. We do have them in the clinic. Most people don't use them, but they're fine. And they have a little U-shaped thing back here that goes towards the throat. Okay, it wouldn't go towards the anterior of the mouth. Cotton rolls slide in, slide out. They kind of help you out a lot when the tongue's kicking up the cotton rolls. On that mandibular, the tongue can be an issue. So you have to tell them to relax, raise your tongue, put the first one in gently, make sure it's tucked in there, then put the second one in there gently. You sort of have to take it slow or they kick those things out at you, okay? They're like little cotton torpedoes, okay? All right, so the type of isolation that we have are cotton rolls, rubber dam, the leaf, the super suction, which I failed to put up there, Isolite, and dry angles, okay? And dry angles are these things. These are called dry angles. They look like triangles, and there's some that are mesh and very nice. These are cardboard and not as nice, but they're cheap, okay? And we are cheap at Sinclair. So, when you use a dry aid, I think that might be coming up, right? Not yet. Well, we'll get to it. So there we are. Rubber dam, ideal, cotton roll, dry angles, these things, and the leaf. Okay, so the oldest method is cotton roll. I will get back to these. And now you can see with this model, the cotton rolls are secured. There's another cotton roll holder, and none of you see, I forgot to get it. It has two prongs, and you have to put the cotton in the prongs, and there's a hump, and the hump goes towards the midline, and something goes underneath. A lot of you we find just don't even like it. Huh?
It looks medieval.
It does, it looks medieval. I mean, I used it at one time, but I don't really anymore. Cotton rolls is old, good for short procedures. Its goal is to be adjacent to the parotid and sublingual glands. The holder that I was talking about is called a Garmer. So if you ever want to Google a Garmer to see it, I know there's a picture in your book, so you can look at a Garmer holder, okay? And if you use a holder, the idea is that you have a little more retraction. Okay, so here's in the maxillary. We retract the cheek and put that cotton roll gently up there. That's all we need on the maxillary. Down below, if we're working on the mandibular, we still want to put a cotton roll up here because that parotid gland, you know how that thing squirts like crazy, right? Have you got a shot yet?
Yeah.
Yeah. And then you want to put the cotton rolls in the bottom on the posterior. This is what an anterior would look like, okay? And on the maxillary, you wouldn't, if you were working anteriorly, that's where you would put that. Dry aids. They can become saturated, so you need to change cotton and dry aids as needed, okay? So there's always during the sealant procedure where after we etched, we rinsed, the cotton is wet. We want to remove the cotton and carefully put some dry ones in there and then dry off the tooth, okay?
Unless you're very proficient at aiming your air water into your high back and you don't even get your cotton wet. I do. That way you don't have to change it.
You're skilled.
You'll get there, but I'm saying like that's one less thing you have to change, one less time for contamination when you're working on a 6-year-old.
Ooh. Yeah.
That'll work quick. Okay.
Okay, so when you are using a dry angle, okay, sometimes they stick to the tissue, and when you're done with the procedure, you're completely done with your procedure. You need to moisten it so you don't tear it apart. There's dry angles. Has anyone not touched a cotton roll before?
Yeah, sometimes it will leave like a film of cotton too that you gotta get off.
Cotton, you can use that as a little pillow. We always tell our little pedo patients, I'm going to put a pillow in your mouth now. We show them the little pillow and then we put it in their mouth.
Oh, that's sweet.
Yeah, gotta talk nicey. All right, so there's the dry angle. It's over the Stenson stuck. Now, if I have this on the buckle, I don't need a cotton roll. You just need your cotton rolls if you are working on the mandibular on the lingual. Okay, and you don't need a dry angle and a cotton roll on the buckle. That's like a lot of crap in somebody's mouth. Okay.
That's what I do.
Oh.
Do you really?
Phoebe knows.
Except PB Hobbs does it, so I guess it's okay.
So, but like,
Well,
you're
your
allowed
cotton
to
roll's
just use.
gonna actually retract out. Your dry aid's gonna sit there and collect everything, so your cotton roll, and then if you're doing a filling, you have a matrix band that sits on your cotton roll, not on your cheek.
Okay, PB Hobbs. Whatever.
Sorry.
No, it's fine. If everybody does their own
Right.
thing.
Whatever works for you.
So I just never done that before. So Hebe Hobb method is both. Rafe Meister method is one or the other.
I love that.
All right.
Just brave myself.
Just Rafe Meister. Yeah, that's what she named me. And I come running like a dog, and I think I'm going to get a treat when she, here, Rafe Meister, here, Rafe Meister.
I think it was like 2 weeks to graduation, and we're like, let's have brave myself.
All right. Cotton roll isolation for sealant. Gently retract the cheek on the buckle and of course put one in the parotid if it's maxillary, and place one or two in the mandibular, or one in the mandibular vestibule. And then on the lingual, of course, place the two on the mandibular, so we said that. Dry aid goes directly on the buckle, and it does the same thing as a cotton roll. It's supposed to absorb moisture, retract the cheek, and the point goes towards the throat. Did you notice it's a triangle? Why would you not put that bulky back there?
Gag reflex.
Huh?
The gag reflex.
Yeah, I'll be up and like this. So you want to put the triangle in the back, exactly. And that is moisture control. End of story.
There's actually not a chapter on this.
Isn't there?
It's just like even.
Okay. So let us do sealants together.
Yeah.